everyone, my name is Charlotte, and obviously Carol's given me a very warm introduction, and I just would like to say I'm very pleased to be here today. I think the title of this conference is just so spot on in terms of where everybody's at with work and life, and I've seen that Cleveland Clinic video, I'd say about a dozen times now, and every time I see it, it just gives you a chill down your spine. I think it's a good way to set up the day, with having patients and families at the centre of our discussion by way of a very emotive clip. So today the theme of your conference is about living, being fit for living and fit for practice. And I think it's a very useful opportunity to remind us all of us, about the need to look after ourselves. Pedro has already mentioned that. We all live in, I don't need to tell you, very busy worlds, and many of us have extraordinary demands on our time, both professionally and personally. It ranges from caring for children to caring for patients and clients to caring for parents. And then there are all the practical things that you do just as a part of life, like running a home, making meals, paying bills, MOTing the car, doing the decorating, doing the garden, ironing. The list is endless. I mean, I could spend the next 20 minutes just going through the list. So there's no doubt in my mind that there are huge demands on people, on ourselves and on our work. But I think for me it's about maintaining that sense of balance and making sure that I have and you have a perspective on life. And the way I like to think about that is my work, primarily as a nurse, but and secondly as a chief nurse. It's important. I enjoy it. It's challenging. It's busy. Sometimes it's even stressful, and it can be complex. It can be slow. It can be fast. It can have competing agendas. And as they say in this part of the world, sometimes it would just do your head in. But, it's work, and I try to compartmentalize it sometimes in terms of work, taking third place to my family first, my life second, and my work third. It doesn't always work that way, and you'll all know that from your own professional roles. But I do try to keep that perspective. But my role as CNO is no different, I don't think, to anybody else in this room who are in a professional role as a nurse or a midwife. And in some ways your work can be even more demanding and more pressurised than mine is. But I think the difference for all of us is that when you leave work, you're still a nurse or a midwife. In other words, we're all professionals. And this means for me that your professional life doesn't start or end when you put on or take off your uniform. It doesn't start or end when you take on or put off your name badge, or when you lock or unlock your office or your computer. It's a way of being, and it's part of your psyche. It's part of my makeup. I can't separate it out easily from the person that I am and the profession that I'm in. And I think one has a direct bearing on the other. So if things are going well in your personal life but not going well at work, or you're going through a really difficult period at work, a sustained period at work, it has for me anyway, and I know others are in the same place, it has implications in your personal life. You just have to ask my husband or my children, and I'm sure they'll be able to tell you what they are. But in my world, when I'm stressed at work for a prolonged period, the effect that it has on me is that I become very quiet and sometimes withdrawn and would disengage, and probably those of you that know me would recognise that. But I think in terms of being a professional, the NMC makes it very clear for us, by way of the code and our commitment to those professional standards, that this is fundamental to being part of the profession of nursing and midwifery. And for the many of us committed expert practitioners who are on that register, the code should be seen as a way of reinforcing your professionalism. At least that's how I see it. And what is more, through the now new process that we'll be going through in terms of revalidation, that will reinforce that professionalism even further. by providing fuller and richer evidence of your and my continued ability to practice safely and effectively when we renew our registration. The code will be central in that revalidation process and will have a focus on, in particular, reflective practice, which I think is helpful. And the code will, I think if it hasn't already, it will become more significant, certainly in your professional life. But I do think that seeps into your personal life as well. And it will also help employers to raise the status of those standards that we all aspire to on that register. But as well as that, and not differently from what we currently do, registrants must also make a declaration about your health and your character and your fitness to practice. And I think that's where it does then become clear that there's a link between your general life, your fitness, your general health, and your ability to function as a nurse or a midwife. But I know there's many of you sitting in this room and thousands of people who are in work today providing direct patient care or looking after complex families or other vulnerable groups who are saying, that's okay for me to stand up here and tell you that. I'm not in your shoes. I'm not the nurse that's on the busy ward in charge of a ward working short-staffed with maybe temporary staff. I'm not a midwife in a labour ward when there aren't enough delivery suites for the women who are in labour. I'm not a mental health nurse trying to prevent people from doing harm to themselves or others. I'm not in any of those positions. And that list could go on as well, like the list in your personal life. But what I do know is that sometimes it can be a jungle out there and things are very busy and people are under a lot of pressure. But in the middle of all that, I see people doing a fantastic job, often in very, very challenging circumstances. And for that reason, I'm very, very proud of the professions of nursing and midwifery, and I'm absolutely committed to being able to describe to people what it is that's uniquely different about nursing and midwifery and how it is that we make a difference to people's lives. But sometimes I think doing that in a fast-moving and challenging environment for a sustained period of time can be a personal expense, unfortunately, to the care provider. And sometimes things can become somewhat unbalanced. And when things become unbalanced, it throws you off course, there's no doubt about that. Generally speaking, these are described often as life events or opportunities to grow and develop or making you a better person or learning, and that's all great, and I'm not in any way suggesting that that's not good, but what I'm talking about is something different. I'm talking about being in tune with how you feel and how you behave and how you act, to know when you're moving from one phase into another, so when it's becoming so sustained that it's actually having an impact on you, and knowing when to check that and what steps you can take to rectify that, and knowing when it might cause problems for you either professionally or personally, or in the end both. And I think it's just reflecting on Pedro's discussion, it's about that emotional attachment, and it's about giving of yourself to another person even when sometimes that's very, very difficult. So if you're not running on full power and you're not completely focused, it's very hard to provide that professional standard and meet those standards that are set out for us by the NMC. So I've taken some of the statements from the code, and I would ask you to think about how you would treat people with kindness, respect or compassion, how you recognise when people are anxious, how you communicate clearly, how you work cooperatively, how you role model professional standards for newly qualified nurses when, if you're not listening to how you feel or how you're behaving or checking the signs. So we need to listen to our bodies, we need to pay attention to our health, and we need to make sure that we prevent ourselves from becoming unwell. But I also know there are times when you can't help that. That's life. You become unwell, you get sick, and sometimes you find yourself in a situation that is outside of your control. And also, but I think underneath all of that, there is a need for us to be at least alert and aware to the fact that we need to look after our own health. We have a public health strategy in Northern Ireland, Making Life Better, which every nurse and midwife has a very key role to play, and is focused on early intervention and self-care. But again, underneath that, is an opportunity for us as professionals to role model what that practice would look like by starting with ourselves and being responsible for our own health and well-being in our personal and professional life. I also recognise that the organisation that you work in has a requirement to support you to provide the sort of care, the type of care that you aspire to provide. And we also know that having moved from patient-centred care to person-centred care means that nurses and midwives need the support of the organisation and the enablers put in place for them to deliver that type of care. And without that structure in place, it's almost impossible to do. But I think starting with your own health is a good start. I've put up here the signs of stress. I've taken them from the Health Service Executive website. It's just a timely reminder for all of us to know what they are and to think about them and certainly be aware of them. And if you're feeling in any way stressed or you feel that you need help, I would encourage you to seek out that help and look after yourself. But also don't be hard on yourself. Being a nurse and a midwife is very, very hard. And like I say, often you give 120% of yourself, even when you don't have it to give, even when emotionally you're drained, even when there are things going on in your own life. But that's part of being a professional. But there may also be times when you start to feel the impact of that. Resilience, I think, will help you cope, helps me cope with that. It's about your bounceability factor. It's about how you come back when you're feeling stressed and how you get back onto your game, how you cope with challenging situations, your ability to adapt to a very changing environment that we all know is in health and social care, your ability to push on even when people put obstacles in your way, and your persistence and what I call your bounceability. I think also then you can find ways to build resistance, and it's important to build resistance by having a purpose. And a focus for the day. What gets you out of bed in the morning? What makes all of us as nurses and midwives get out of bed in the morning to go in and do a good job, to provide the type of care that we want to provide? Have confidence in yourself and your knowledge, and be capable and focused in terms of what you're doing, and be confident in your role as a nurse or midwife. Use your emotional intelligence. Most of us have it in abundance. It comes with experience and skills. Listen to yourself. Hear what your body's telling you and how you're responding to the environment you're working in. In terms of social adeptness, it's about self-esteem, self-belief, and having confidence again in your views and being able to articulate that. And physical robustness, assessing your levels of energy. Are you bright-eyed and bushy-tailed? Do you get up with a bounce in the morning? Do you have ability to bounce back to situations? And on a very practical level, I would encourage you all to get your flu jab. Don't judge me, I don't like needles either, I prefer to give them than get them, I can tell you. But your flu jab will help to protect you, protect your family, and protect the patients that you're caring for. I think also exercise has a really important role to play in terms of health, not just physical health but also psychological health. The research states that the exercise provides enhanced mood, better able to deal with situations, more clear thought processes, better sleep, longer periods of deep sleep and feeling much more refreshed in the morning, reducing stress, less anxiety, and improving levels of depression. Exercise improves your mood and alleviates one of the main causes of stress, which is mood. All of these things are important in maintaining a healthy body, and of course you have the added benefit of exercise that after you exercise your metabolism is working faster and harder for 24 hours even after you stop, and that for me actually is an added bonus, because you're burning calories. So even after you stop, your energy wheels are still going. And what I wanted to say to you really in relation to this is you don't have to push yourself like these ladies here. That's not what this is about. It's about looking after your body, it's about finding time for yourself, it's about re-energising, refocusing and revitalising yourself. But we couldn't just focus on the ladies, and so for the men, it doesn't mean take it to the extreme here as Olivier Giroud has. Many of you will know who he is, many of you may not, but he is a professional football player, plays for Arsenal. And the reason that I put this up really is Giroud is a professional. He's a professional footballer. He's, in some ways there are similarities between all the professionals. And I use just to make the point that being the profession is not just when he's playing the match, it doesn't stop when he takes the shirt off. It's part of his life, it's part of his psyche, it's how he behaves, it's how he lives his life. And it's the same, I think, in relation to nursing or midwifery. Now, particularly in football, but in most professions, some people do that better than others. That happens in all walks of life. But it's really just to make the point on the links between exercise and maintaining your health. And just in case you think that I'm preaching, I am actually taking my own medicine. And this is a photograph here of the team at the department, the Nursing and Midwifery Directorate, started like just a kind of a get out of the department to get some exercise, started off with a walk, and then we said, well, we'll maybe do a wee bit of running, and then we started just doing like 2.5 miles, takes half an hour, whatever. Then more and more people started to join, and then the email started about, I did 5k on Saturday in 35 minutes, and then, well, I did my 5k in 34 minutes, and then it all just kind of mushroomed to the extent where we decided to put a relay team into the Belfast Marathon last year. Now, not all our team members are here. Mary Frances is in the audience there, I see her. Andrew Drury is still on holiday and hasn't got married recently. And Nadine, who's one of the civil servants who works in our team, actually really helped us all because she was a runner and she kind of did the coaching stuff with us. But we raised £1,500. It was really good team building. We all felt fitter. Then we all kind of dropped off again, and now we're back focused on running a couple of days a week, either before work or after work. So I am actually role modelling good behaviour for the profession, and taking the whole issue